I'm going to start off by asking a question so that you can maybe think about following my path here. It seems to me that with the time cycle required to get approval, about 3 to 5 years, and the way technology moves, by the time you finish your approval, you get it in hand, your technology is obsolete.
Yeah.
I want to hear from you as far as what do you think we can do to make this go faster? Don't send the ball back into my court and say the government, et cetera, but I think you had some ideas there, like,
yeah.
For example, outside U.S. testing, and whether that could be used for here as well. But is there anything that you recommend that you have seen that you can talk about to make that go faster?
Well, obviously, I think building a good relationship with the regulators is invaluable, and they got to trust you. Thinking about your design being scalable and applicable to multiple areas. I know one example, we always are running out of memory, or the memory chips that we bought don't even exist anymore. So being able to build a design that can plug and play different components is a good idea. But yeah, I think right now we're in an interesting phase in the regulatory world that the government is risk averse. So whatever you can do to document and demonstrate that you've thought of all the risks and you've designed in mitigators and made it easy, mistake-proof, foolproof, so that they feel comfortable that this really is going to be a safe technology, and the benefits are going to be, far outweigh them is really the key.
Thank you. Maybe we should follow the example of the pharmaceutical industry, no pun intended, have these commercials on television about using this device, and here are the risks. Could cause suicide and those other things.
Yeah.
Please, any other questions?
Increasing number, obviously, of applications in healthcare on consumer-tracked devices, which involve commercial wireless networks, cells, etc., which have got nothing to do with healthcare. Just curious about your impression from the FDA's perspective about incorporating a semi-reliable network, like a cell network, into a medical device, and at the same time, how do the networks feel about becoming part of a medical device, whether they like it or not? Interesting conflict there, especially with respect to liability. Any comments or
Yeah, I think we haven't gotten into the cell phone connections directly yet, but I know we've had to wall off the internet and say, okay, that's not a medical device, and we're not going to be able to regulate it, but we are going to rely on it as a pipe to get from the data from A to B. And I think FDA has been reasonably okay with that. But what happens when our internet provider goes down and all the patients around the world, their critical medical device data can't get to their doctor?
Right.
Well, in some ways, I tell the FDA, well, then we're back to what they had before we didn't have the internet. They still have a pacemaker, and it's still delivering therapy, and we have a backup alarm. So the patient themselves will get an alarm or a buzzer and say, oh, that means I'm supposed to call my doctor. So, we think about fail-safes like that to kind of work around these systems that are not part of the device yet are, part of the communication chain.
What about the opposite response of these private networks to becoming part of this regulatory environment?
I don't have any, I don't know if you do, Chuck, but I don't have any experience with their, how they feel about that, to be honest.
I just pipe in, my understanding from the FDA is that it doesn't store medical data and it's used for other reasons, like just normal data and telecoms, then it's not part of it. So there seems to be a very narrow wedge on when all of a sudden the systems become part of the FDA process. So understanding when it is and isn't, I think is very important. It's therefore we always try to say it's not.
Well, what's interesting is that you have a supplier like Apple, who's actually, as part of their licensing agreement, explicitly stating that you may not use their iPad, iPhone devices as part of a medical device delivery. So it's not just the regulatory environment, there's also a litigation issue. They're concerned about whether or not they're going to be, bunched up into the litigation should something go wrong, and they're not even aware that their device is being used for that application. And we've been waiting 2 years for the FDA to come up with guidelines, so I guess everybody's kind of, standing off here and hoping something falls in line. In the meantime, 2 years have gone by, and product cycle and a half as well. So it kind of goes to your comment about how that regulatory litigation environment is impacting the ability to deliver innovative devices to the marketplace, in internet time rather than in, government time.
Yeah, I think very quickly my comment was really having looked at some of the other countries as well, we tend to be pretty strict about how we do things here, very risk averse. Whereas other countries, because their motive is it's competitiveness. Honestly, it is. They want to be part of the community and go ahead of, get ahead of the U.S. And so therefore they bypass some of these things. It's a return on investment for them, for the sake of getting to the next level. And they do things faster.
Speaking from the provider side of the organization, my name is Matt Sims. I work at Mass General Hospital and Partners Healthcare, and we're very mindful that part of the allocation of responsibility and liability for the efficacy of such systems that incorporate potentially unreliable networks in the course of transmitting data from a patient's body to a provider who may make a decision on it. We see two regulatory changes that help the providers be part of accepting the responsibility for the fact that things can't be perfect. The two regulations, and I'll just mention them now and then talk a little more about them in my talk this afternoon, are the 80,001 rule and Mdds, the Medical Device Data System, both coming out of a group of committees, but led very much by the FDA. And the essence of 80,001 says that if Partners Healthcare chooses to deploy wireless sensors at home for congestive heart failure monitoring as part of a system that incorporates a cellular network or a wireless or the internet, a physician or a responsible party in the provider organization is on record as saying, I accept the responsibility for the fact that data may not get through, or here's what we'll do if it doesn't. The medical device data system rule basically says if anybody as a software developer within a provider organization creates an application that links data from a monitoring device and sends it someplace else where it may be used, we have to have a quality system, et cetera, and decent documentation. So I think to just make sure the focus isn't on just companies to make systems that are end-to-end that are perfect. The provider organizations have to play a role too, and I see these new regulations as giving us, the providers, a place to step into the liability and acceptance of responsibility for the systems that are being used to provide better care, and that we know what to do when they fail.
Right. May I suggest that for the sake of staying on track here, that we move on to the next speaker, and of course we'll have opportunities to have side discussions, which I really encourage you to do. With that in mind, Chuck Farlow from Medtronics.
May I suggest that we actually go straight over all the presentation and then we walk ahead?
Sure.